Thank you. Are you going to hear me? All right, thank you. My name is Libeya, Bethwel, as we've heard. This is a setup. Speaking after your senior is a setup. But I won't take much time. I'll be able to point out a few things that I was asked to highlight, and then we'll be able to welcome questions. And thank you so much, Dr. Joy, and also Dr. Liz in absentia. I'm a silent student of your comments and conversation in non-clinical doctors group, so I keep on following and learning a few things here and there. Before I delve into what I need to share about the role of pharmacists in primary health care, I had two questions that I wanted to pose in the previous plenary, but I think time wasn't on our side, so I'll leave them hanging. I'll just mention them and leave them hanging, and perhaps Dr. Joy can pick it up when we'll be having the plenary after this. The first question was in relation to health finance. Health financing, we understand that the Kenyan health system is hugely donor funded, and it's now a few years after our status as a country was elevated from lower middle income country to low income country to lower middle income country, and that comes with certain ramifications in line with donor funding. And so we've had some of the donors phasing out bit by bit so that they can reallocate their resources to countries that are in need, although we are still in need. So how does that play the current state of healthcare in Kenya? Are we prepared as a country, or we are yet to get there? And then tied to that, I read somewhere about HIV, and here is where we as youth, I'm looking at the theme, I think it's partially covered, where we come in. Statistics have it that adolescent and youth who are 29 years or younger make up 61% of new HIV cases. 61% of new HIV cases. These are 29 years and younger. So, which are some of the areas that we can focus at as young healthcare professionals to ensure that this number goes down? Because it seems as though things are getting out of control. For those who've done internship and who've been at the CCC, I happened to do my internship in Nairobi, and one of the level 4-5 hospitals in Nairobi, and handling the cases was, I mean, at the end of the day, you need to go for therapy, because the number of young people that visit that facility to take the medicines, I mean, it leaves you with many questions. So where can we as young healthcare professionals focus on to ensure that this number goes down? And also that, the products for HIV are hugely funded by the donors. So how does this play in light of the first question, where we have a dwindling donor fund in the healthcare system? Thank you. So I was asked to talk about the role of pharmacists in the healthcare system, and there are quite a number of things I've covered in my notes that have been mentioned by previous speakers, so I won't belabor much on them. Number one thing that I want to talk about is the paradigm shift that has been happening in the healthcare space. And what we have currently, or the changes that we're experiencing currently, is not what was there 5-10 years back. And if you're to keep up with the pace of evolution in the healthcare space, then we need to be on top of our game, especially as young healthcare professionals. Number one thing is the disease burden in the healthcare system. Initially, if you look at how the healthcare system, and of course you've been told or been taught the 6 pillars of the healthcare system, all of them were designed to handle what we call communicable diseases, malaria and the likes. But over time, as we enhanced our craft in managing them, or even before we enhanced our craft in managing them, we have NCDs coming in. And so NCDs cases have been in the rise. For those who don't know NCDs or don't have a medical background, NCDs are non-communicable diseases, and especially those that come as a result of lifestyle change. And so we've been having cases of diabetes on the increase. We've been having cases of blood pressure on the increase. We've been having cases of COPDs on the increase. We've been having cases of obesity, arthritis, all of them on the increase. And yet the health system has not been designed to hold or to address that disease burden. So that is one of the paradigm shifts that we've been having in the healthcare system, and every effort now is geared towards addressing that paradigm shift in disease burden. That's why we're having conversations on primary health care. Are we together? Tuko pamoja? The second paradigm shift is how we perceive service delivery in the healthcare space. Initially, you'll be trained and then deployed to your place of work. And as a professional, Dr. Cohen mentioned that we have more than 33 cadres in the healthcare space. Most of us will have a microscopic view in terms of delivering healthcare. That I'm a trained pharmacist, and so my concern is about commodities and dispensing, nothing else. But that has been changing to a place where many of us are embracing a macroscopic view of the healthcare system or service delivery, where you're looking at all the 6 pillars and finding your niche where you're able to put your hands in the work to deliver the best quality healthcare. So that has been the second paradigm that has been happening in the healthcare space. And of course, you've heard previous speakers describing the different healthcare pillars, and all of them touch a pharmacist in one way or the other. I'm a pharmacist. I've worked in the community for 1 year. I've had time in the hospital. I've had time in the industry. And there are a bit of things that I understand. And so there are 3 pillars that directly touch you as a pharmacist. Of course, the rest also influence how you practice and your space of practice. But there are 3 that I felt they come in direct contact with you. Number 1 is the pillar of HPTs. Health products and technologies. You are the expert as a pharmacist. You've been trained on how to handle health products, on how to handle medicine. So that is your domain. Number 2 is HRH. Of course, you are a healthcare professional. You are healthcare. You fall under healthcare human resource. That is a pharmacist, where you deliver your pharmaceutical care service. And then the third one is service delivery, of course, where you are expertise as a drug expert or medicines expert is needed, delivering pharmaceutical care. So the 3 pillars is where you as a pharmacist interact directly with the healthcare system. There is the aspect of expanded role of a pharmacist. The traditional pharmacist is not to dispense. You sit behind a counter in a room with a small window. There's one lecturer in UNN used to call us glorified shopkeepers, an anatomy lecturer in first year. And I didn't like that word, glorified shopkeepers. And it has been shifting from being glorified shopkeepers to actually being players in patient management teams. And some of the internship centers have been very deliberate on that, where they train you as a pharmacist intern on how best you can put your knowledge and skill into practice to ensure that the patient gets the best out of you. So it has been shifting from dispensing to something else. It has been shifting from dispensing to actually offering pharmaceutical care services. And so where does a pharmacist fit in PHC, primary health care? Where does a pharmacist fit in primary health care? Dr. Tari has done a lot of work to explain what primary health care is all about. And so I'll be brief on that. When we talk about primary health care, there's one aspect that is not talked about enough, the aspect of community pharmacy. Statistics have it that 60% of patients begin their journey at the community pharmacy. That is their first point of contact with the healthcare system. And many of us as pharmacists, we find comfort in large towns. Of course, we know that money is in large towns. But as the Tari has put it, it's beyond money. It's about bettering the healthcare system. It's beyond money. Where value is delivered, definitely money will flow. And again, many of us are moving from the clinical side, or where we are needed to put into practice our skill and knowledge, to actually addressing the system. Not all of us. So tukitoroka wote nani atabaki kwa kuhudumia wagonjwa. I overheard David mentioning that during tea break. Wote tukitoroka kutoka kwenda kuhudumia wagonjwa, who will take care of them? So some of us need to find space in actually being on ground to serve the patients, and your skill and knowledge is needed. Your skill and knowledge is needed. Let me talk a bit about community pharmacy and the expanded role of a pharmacist. Perhaps you've been taught that being in community pharmacy is about dispensing, supply chain and all that, but it's beyond that. I spent 12 months in community pharmacy. I was trained in 2021 as an advanced family planning service provider. There is a course on vaccinology. Pharmacists are being trained to offer vaccine-related services at the pharmacy. And so over time, we've been seeing the role of a pharmacist in a community pharmacy being expanded. And if you look at the spirit behind primary health care, there are three aspects that I would like to quickly mention where a pharmacist can play a role. Of course, every other healthcare professional can find their space in these three aspects, but a pharmacist can also find their space to practice under these three pillars that I call pillars. Number one is primary prevention. In primary prevention, if you're working as a pharmacist in a community pharmacy where most people begin their journey or they begin their interaction with the healthcare system, you can offer services in line with primary prevention. And this entails health promotion, advisory and counseling services, educational programs to drive lifestyle changes, because you're interacting with them on a day-to-day basis. And I used to do this a lot while in community pharmacy. People will come, they have lifestyle, someone has been on hypertension medication, but they don't know how to take them, or they've not been taking them according to how they're supposed to take them. I used to get opportunity to advise them, teach them, educate them on diet and all that, and their lives and their health improved. So we can find space to practice in that aspect. There is the secondary prevention, and this is mainly entail health assessment and screening to facilitate early identification of chronic diseases. The CHPs are doing this currently. They're walking around with BP machines. That is screening. In a community pharmacy needs to have a blood pressure machine, needs to have a blood glucose monitoring machine. Because you have patients coming in and you need to monitor them. Some of them cannot afford to buy that set and have it in their home. So you can offer that service to them, and that is part of primary health care. You are helping to assess, you are helping to monitor how they are doing as far as their treatment is concerned. And the third one is tertiary prevention. And under tertiary prevention, we have management of chronic diseases. Management of chronic diseases talk about medicine refills and all that, monitoring of the vitals, liver function tests and all that. That is under tertiary prevention. If your facility is a little bit advanced, you can do that. I've seen people embracing collaborative practice, where we take a whole, we find a space, and then I'm a pharmacist, there's a lab technician, there's an MO, and then we cost share the rent. But every person, and we have all the services under one roof, but we cost share. So an MO runs the clinic, a lab technician runs the lab, and me as a pharmacist, I handle the drugs. That is collaborative practice. You don't necessarily need to have all the funds to set up that complex, but you can get people who are willing to get in that space, then partner and begin the practice. So that can be offered under tertiary prevention. Yeah, that is it under primary health care. I've tried to rush through it because my time ilikuwa nainuliwa karatasi juu, but I think we'll interact more than plenary. Thank you so much.